the new episode of MedTech Talk. I'm your host Shruti, and we have Dr. Abhay Chopada sir with us. Hello, sir. I recently read that India has become the cancer capital of the world with fastest rise in cases worldwide. As terrifying as it is, as we talk about AI and other technological advancements, so today I want to talk about how AI or other technological advancements can help in early diagnosis as well as prevention and treatment plans of cancer. So let's dive into it.
So first of all, let's address this issue about what is cancer. And cancer is not one disease. Cancer is multiple different diseases which behave in a similar fashion with uncontrolled proliferative cell growth. But they all actually are less, they are not the same in the terms of their danger. So for instance, if I have a skin cancer, I can have it and nothing's going to happen to me. Especially if it's a basal cell cancer, I can survive very nicely for another 20 years, 100 years. On the other hand, cancers, let's say in areas like pancreas, you might be dead in months. Now, we've never understood this very well simply because we didn't have an insight as to what is drawing this particular process. What AI has done is it has given us the ability, because we had a lot of technological progress with gene sequencing, looking at mutation analysis, proteomics, and all this started giving us a massive amount of data. And what AI is now allowing us is to say, okay, if you give us enough data, we can now cross-check and tell you why a specific cancer is happening. And that is allowing us to design treatments or therapies, usually especially using biologicals, to take care of that cancer. So, but that's on the therapeutic side. Your question is, how can it be used for early diagnosis? So just extend that same thinking that if I know what mutations are happening, now I can do a blood test. And that blood test, if that particular mutation or the gene is present, then it effectively means that there's a likelihood that there is cancer around. So it's known as a liquid biopsy. And over the last 5 years, liquid biopsies is all the rage. Where you do a blood sample and check for 20 types of cancer, 50 types of cancer. It's already rolled out in the NHS, by the way, in the UK. So that is again AI driven.
Right.
So AI has a very, very significant role, not only in picking up early cancer, but also in establishing the diagnosis, doing the genomic analysis, and offering you treatment options.
Right. Wow. Okay, sir. The next question is, the concept of precision medicine is gaining traction in oncology. How does AI contribute to this approach, allowing for highly personalized treatment plans?
Sure. Again, let's go back to what is precision medicine. And precision medicine means that trying to do the treatment without trying to hurt anything else and minimizing the side effects. Now, let me explain it to you. Today, when let's assume you have fever, and I want to prescribe paracetamol, and let's assume amoxicillin.
Right.
I'll give you the same dose that I would give him or her, but your metabolic systems are all different. So you might not need 1 gram. You might need, let's say, 700 milligrams. You might need 400 milligrams. Today, there is no way of knowing what is the correct dose. But you might say, what's the big difference? 700, 1000. But that remaining 300 might be responsible for causing some side effects for you.
Right.
It might have harmful effects on you.
Right.
So what we overall think is, why can't we have a precise way of understanding what you need for a correction? And this can be applied to everything, whether it's medication, whether it's for surgery, whether it is for radiotherapy, whether it is for cancer chemotherapy. We want to know exactly what your body needs.
Right.
Now, AI is obviously facilitating this because we're collecting data and then figuring out, okay, at this particular level it seems to work.
Right.
This is the kilogram, so this is what it potentially needs per kilogram. It's not perfect, but over a period of time, precision medicine will only be possible out of analytics. And those analytics are only possible using AI engines because of the complexity of the data.
Right.
So there is a very well documented journey towards precision medicine which will be powered by AI.
Right. Wow, that's great, sir. We can basically go to a root cause and then build from there, right?
Yes.
Wow. Okay, so the next question is, beyond theoretical promise, are there concrete examples of AI applications making a tangible difference in the lives of cancer patients?
Yes. So let me first say that AI is not new. AI is just an ability to synthesize data And because that's what humans do, we started calling it AI. But we've been doing synthesis of data in medicine for a long time, and the first thing that you know is the CT scan. We had an X-ray, then we realized that if I take an X-ray from 360 degrees and just look at those images and apply a formula, then I'll be able to reconstruct the whole image.
Right.
That's a CT scan. That was the earliest example of an algorithm can pull the data and reconstruct it. Right? Now, when you look at what else is AI capable of, as I said, we can do population analytics. We can actually take a patient and analyze his requirement from a very, what I would say, focused perspective to offer him precision medicine.
Right.
So when it comes to medicine as a whole, AI definitely is going to integrate itself to be an inevitable part of a doctor's decision making.
Okay.
And I can see that AI-driven healthcare is the future.
Right. Wow. Okay. So my last question to you, sir, is as AI technology continues to develop, how can we expect it to further enhance the capabilities of oncologists and empower patients in the next decade?
Again, like I said, we are not waiting for the next decade, my dear. We are already announcing them.
Right.
In fact, there was already an initiative a few years ago, which was out of Manipal Hospital, which had tied up with IBM.
Right.
And they started looking at how we can offer personalized treatment plans for cancer patients. It was too early, and there were some limitations of how they were doing it. But imagine, today I have the ability where I can take all the data that's available for me. You know, your background history, your age, your gender, your genetic profile, your medication history, your allergy history, and literally use a bot to say, now let me try to find out what is the most optimal therapy for this lady. Is it perfect? No. Will we allow unbridled oncology care using AI? No. But I can augment oncologists who will still be the final arbiter. So yeah, this logically makes sense, let me try this. Oncology, you know, the ultimate aim of the world should be to eliminate cancers, not to treat cancers. And my feeling is once we start understanding very clearly what triggers a cancerous growth, which some people believe is a prion, some believe it's an infection, some people say just mutations which are random, we don't know. But if we can figure out what it is, I think we will be able to prevent cancers, not just treat or control them.
Yeah, that's the dream. And from what's happening right now, it's of course a very huge step, even if we can streamline and make the whole thing fast. So, yeah.
Yeah, the personalized cancer plans are already there. They're not yet that validated, and the reason for it is the databases are pretty small.
Right.
Whether they're showing promise, of course. Whether it'll be a reality tomorrow, 100%.
That's great, sir. Thank you so much for your time, sir. This truly gives hope to everyone around us, because cancer is something that we, as not just Indians but as a global community, should come together and try to defeat it, definitely. So thank you so much for your invaluable insights as always, sir. Thank you.
Thank you.
To our viewers, like, comment, share and subscribe to our channel for more such insightful content. If you have any ideas that you want us to talk about, definitely let us know. Until then, stay safe, stay informed, because your health is in your hand. Thank you.